Hi, I'm Albert Einstein.
Hello, Mr. Einstein. I'm President Woodrow Wilson, and I've seen some patients with leprosy and became a little curious about it.
Well, leprosy, or the Hansen's disease, is caused by the pathogen Mycobacterium leprae, which is a slowly dividing bacterium, causing skin lesions and nerve damage as you have seen.
How long has this disease been around? And where did it start?
Leprosy has been mentioned in the Bible 68 times, and this is the only clue about the beginning of this disease. We also know that it is a worldwide disease with about 150 new cases reported annually in the United States alone.
What are the symptoms of leprosy?
Symptoms of leprosy appear usually around 3-5 years after a person has been infected. Leprosy usually affects the skin and nerves. However, the severity can differ based on the type of leprosy.
There are types of leprosy.
Of course. There are two types of leprosy: tuberculoid leprosy and lepromatous leprosy. Tuberculoid leprosy is the milder form of leprosy, and early symptoms can be slight red patches on the skin. Other tuberculoid symptoms include severe pain, muscle weakening, skin stiffness and dryness, loss of fingers and toes, and eye problems, which eventually lead to blindness.
What about leproma? Leproma. The other one?
Lepromatous leprosy is the more severe form of leprosy. Lepromatous symptoms include thickened skin on face, bloody nose, laryngitis, collapsing of nose, swelling of the lymph nodes, and scarring of the testes, which leads to infertility.
That's scary.
Yes, worldwide, there are 1 to 2 million people disabled because of leprosy yearly.
I almost forgot to ask, is leprosy contagious?
Calm down, President. Leprosy is not very contagious due to the fact that 95% are naturally immune to leprosy.
Well then, how does leprosy spread?
Leprosy is spread between person to person through respiratory droplets or close contact with an infected person. A person who is not immune to this disease can be affected when in contact with a person with leprosy.
What does this disease do to your body exactly?
Well, leprosy doesn't affect the central nervous system. However, may affect the sensory, peripheral, motor, and autonomic nerves. When the sensory nerves are damaged, they cannot register pain. Therefore, hands and feet are vulnerable to injuries, which result in the loss of fingers and toes. When the eye is damaged, it can lead to blindness. When the motor nerves are involved, people can experience various forms of paralysis. When the autonomic nerves are damaged also, leprosy can affect the ability to sweat, leaving the skin dry and cracked.
Are there any cures for this disease?
Before the introduction of multi-drug therapy in the 1980s, the disease was only able to be slowed down, but now can be cured. With the appropriate treatment, leprosy can quickly become non-infectious.
What about vaccines? Are there any?
Unfortunately, no vaccine has been discovered for leprosy yet. The vaccine for tuberculosis may provide some protection against leprosy, but it is not guaranteed.
Thank you, Mr. Einstein. I'll immediately quarantine those with leprosy just in case there are people not immune to it around them. I've learned so much.
I hope to see you soon, Mr. President.